high-risk patients for dental implants. So dental implants are typically a very common procedures to replace teeth. I will divide these high-risk patients into two categories. One are the local factors, other are the systemic factors. When I say local factors, the local factors are to do with the bone. When there is no bone to start with, or there is very little bone to start with, it becomes difficult to place implants. So in those scenarios, what we usually typically do is to do some bone grafting procedures. It can be a sinus lift procedures. So when we do those, we artificially try to grow bone and then do implants in those artificially grown bone. In that area, so in some times it becomes a high risk because there is chances of failure of the bone graft and also chance of failure of the dental implants. So that's one aspect of it. Systemically, typically a high risk patients would be on somebody who is on some medication for long term, like medication for osteoporosis. Typically these medications affect the metabolism of bone, how the bone reacts and how the bone forms and then resorbs. These medications are called bisphosphonates. Patients who are on those bisphosphonate therapy, we don't usually do dental implants there because it affects the healing of bone. When it affects the healing of bone, then there is a very high chance that the implants we do not only will fail, but it can cause other complications also. So this is one of the high risk when patients are on therapy for osteoporosis. Sometimes high risk patients are the one who are having a surgical risk. When I say a surgical risk, people for various conditions might be on anticoagulant therapy where the bleeding cannot be controlled. Then it becomes a surgical risk. People who are having some metabolic disorders, having some liver problems, having some renal problems. So where the kind of medications we do, the kind of surgery we do has to be a very, they are high risk patients for dental implants done. But generally on the larger scale, if you look at it, most of the patients who are surgically fit to get their teeth removed will also be surgically fit to get the dental implants done. To keep it short, what I would like to say is, if you have any pre-existing medical condition, do speak to your dentist, make them understand what are the medical conditions do you have, make them understand what are the medications that you take so that the dentist is very clear about the risk factors in getting the dental implants done. If required, your dentist will get in touch with your physician or your surgeon to get a fitness for the procedure done. And after that, when you do it, most of the local factors or the systemic factors can be controlled. This is Dr. Arun from Pearls Dentistry signing off until next time. Bye bye and thank you.
Do you like the video? Press the like button. Do subscribe and click on the bell icon to receive such videos. Thank you.